Welcome to Cadonic's cloud-based clinical documentation. In this brief video, we present two different clinical documentation solutions. An example of a custom template, an example of occupational medicine contract. We use a version of our tracker board to display patients, but the actual clinical workflow can be embedded into any documentation system that can support a URL link. In this slide, we see a sample version of our standard tracker board. It has been preloaded with 6 different representative patients. To begin charting, simply click on the patient skin biopsy located in room 1. In this demonstration example, we have automatically assigned you with provider privileges. This will automatically bring you to the patient's current chart. In this example, the staff has documented the reason for this visit is a skin biopsy of the left hand. They have also entered routine information including vital signs, height, weight, allergies, and medication history. Because the chief complaint is here for procedure, the link Go to Procedure is highlighted in red. Click on this link to begin charting. As with any invasive procedure, you will be asked to confirm the procedure and the patient's identity. You will then see this screen. This is a scrolling list of an unlimited number of custom procedure templates. In this demo example, we've only loaded one template. Be sure to double-click on the link to skin biopsy, and in our sample, we've added a little bit of history and symptoms and risks. This type of screen allows for charting by exception. Common symptoms and risks are preloaded with a no. As the user, all you have to do is document yes answers. If you did not ask or document a particular question, click on NA. If you don't make any choices on this screen, nothing will be entered. On the next screen, you will be given a mannequin so that you can define the site of the biopsy. Simply click on the dorsum of the right hand and then click Next. In the background, the program will automatically import your standard template description of a routine skin biopsy, so there's no need to further document. Finally, for coding, you will see on the next screen the options for the type and number of biopsies that you performed. This will automatically assign the appropriate procedure codes. Once you have chosen the number and type of skin biopsy samples, you may click on the next screen to return to the patient's chart. This is the output. Note the history in the procedure note, generated from your custom template description. Not shown on this screen are the relevant ICD-10 codes and procedure codes, simply because they don't fit on this screenshot. So this is an example of a simple custom template procedure. This workflow lends itself to multiple types of repetitive problems where the basic procedure is always the same, and it only varies by such things as anatomic site and type of biopsy. In the next series of slides, we will look at our occupational med solution. Shown on this screen is a sample contract for the ABC company. Note that there are an unlimited number of services that can be offered. This screenshot only shows some of them, and each service may have a unique price for that company. Each company may have multiple contracts for different services, and we support an unlimited number of companies. On this screen, to start Occ Med documentation, click on the patient Occ Med appointment in room 2. As before in the previous example, the staff has already documented the patient's vital signs, height, weight, medications, and allergies. Note that 3 orders have been automatically placed. These were generated when the relevant contract was chosen for this patient's visit. Also note that because this is an Occ Med visit, the 2 appropriate links are automatically highlighted in the red at the top. One takes the user to the order documentation screen where the user can complete the visit by clicking in the completed column of the orders. The other allows the user to review the plan and any specific instructions. So click on the Occ Med red link. This is the order documentation screen. By clicking in the completed column, you can complete the exam. When the urine and blood samples are obtained, click on the completed column. When a provider clicks on the completed column for the Occ Med general exam, they will be automatically taken to a standardized Occ Med history and physical exam. Is taken to this default history screen. It's quite extensive, and often sites will give the patient a paper copy where they can document any positive findings. Once the positives have been entered, You can click on the link shown in this screen and it will automatically fill in the appropriate negative results. Note, the patient's medications have been automatically imported. On the next screen, we have a simplified physical exam screen. This screen allows for a very quick survey, but also supports an in-depth analysis if needed. You can either document just the areas that you examined, or if you did a complete exam, you can enter only the positives and then automatically enter the negatives. Once you are finished, you can print the occupational med history and physical forms as noted on this screen. To print the charts, you must have Adobe Acrobat Reader installed to display these PDF charts. This concludes our introduction to the procedures in occupational medicine in codonics charting.